Welcome to this guide to the National Health Service. The National Health Service is usually known as the NHS. This guide tells you about how health services are provided in Scotland and how to get help when you need it. The NHS provides many different health services. For example, there are local family doctors, hospitals and clinics, nurses, pharmacists, opticians and dentists. We have made this guide to help you find and use the health services you need. The guide is made up of different films. You should watch all the films to learn about the most important health services in Scotland. To get many NHS services, you and your family must register with a local family doctor. Most people call the doctor their GP, which means general practitioner. Please watch the film about GPs to find out how to register. Most NHS services are only available during the day from Monday to Friday. But there are other places you can go that are open at other times. You can get advice from a pharmacy. Pharmacies are usually open for longer hours than GPs. If you need help at night, at the weekend or on a public holiday, you can phone NHS 24 and someone will tell you where to go to get help. When you phone NHS 24, if you do not speak English, you must say the name of your language. Please try to say this in English to help NHS 24 get the correct interpreter. Please watch the Out of Hours film for more information about NHS 24. The phone number for NHS 24 is 08454 24 24 24. The text phone number is 18001 08454 24 24 24. If you have a serious accident or illness and you need help immediately, you can go to a hospital that has an accident and emergency department. NHS 24 can tell you where to go. If you think someone is so ill that they may die, you must phone 999 and ask for an ambulance. If you don't speak English, you can ask for an interpreter when you phone 999. You don't have to pay to see a doctor or to go to a hospital. The government pays for health services in Scotland. But you may have to pay for some things, for example medicines and dental services. Some people do not have to pay for anything. For example, children younger than 16, asylum seekers, and people who are getting social security benefits, for example, income support. People who are aged 60 or over and women who are pregnant do not have to pay for some things. To find out more about what you have to pay, there's a leaflet called Help with Health Costs, also called an HCS2 form. If you have a small income, you can get help with paying for health costs. To get help, you must complete a form called HC1. You can get this from a Job Centre Plus office, a GP practice or a pharmacy. You can also phone the NHS Low Income Helpline on 0845 850 1166. Tell them if you need an interpreter. If you don't speak English or you don't understand English, the NHS has interpreters that you can use. This is free, but it may be difficult to get an interpreter for some health services. Sometimes an interpreter will go with you to your appointment. Sometimes the interpreter will talk to the doctor, nurse or other person by phone. Please ask for an interpreter if you think you need one. If you prefer a male or female interpreter, please ask for that. If you have friends and relatives who can speak English, they can help you complete forms and make appointments. But when you see a doctor or go to a hospital, it's better to use a professional interpreter. A professional interpreter will make sure you understand the medical words. Interpreting services are confidential. To find out more about the NHS, look at the rest of the films. You can also phone the NHS helpline. Telephone 0800 22 44 88. Text phone users dial 18001 0800 22 44 88. The NHS helpline has interpreters to help you. Just say your language when you phone. We hope this guide gives you interesting and useful information.